memories to unfold.
I just want to first really thank the organizers, Dr. Gleason, Dr. Carter, Dr. Sanjay, for inviting me to be the keynote this year. It really is my honor to be here with all of you and share some of the things that we're learning about older African Americans. I hope that, after my presentation, we can have a rich discussion and, questions about things I've said or found and what you have thought about as you go through this journey of research, and whether or not you're in studies or not, you can really hopefully learn something today. So also I want to acknowledge the young artist, Jonah, is his name, right? Amazing, amazing work. Thank you so much. Our young people are so important to us. And the actual Dr. Solomon Carter Fuller, you look so much like him. Thank you for being here. So I want to just acknowledge also special thanks to the event founders. Miss Charlie Daniel, is she here? No? Okay, and Dr. Dorothy Farrar Edwards, I know you're here. Thank you so much for founding this great celebration. It's amazing how big it's grown. This is my first time coming, I think, but I was not expecting so many people. So this is really, really remarkable. And I want to also acknowledge that this event is presented in partnership with AA-FAIM and with support from CLARiTI, PREDICT, the RAP study, and All of Us research program. So thank you all for supporting this event today. So the title of my presentation is Alzheimer's and Cognitive Aging in Older African Americans. And I want to just first give you a brief outline of what I'm going to talk about today. And I don't actually, can you be my timekeeper? Okay. So just so that I don't go over. So I'm going to start with a brief historical view of Dr. Solomon Carter Fuller's impact. I know that a lot of us know, who he was and what he did for the field, but I want to just give a little brief, background on him. And then I want to talk to you about my own research in Chicago that's really focused on prevention of Alzheimer's, and it really tries to center African Americans in the research. And I'll present just a few of our findings. And then I want to just highlight some key prevention strategies that I think we all can do to protect brain health. So who was this wonderful, wonderful man, Dr. Solomon Carter Fuller? And as we can see on the pictures out there in the wall, he was a true pioneer. And I had the opportunity to learn a little bit more about his life. I knew who he was, obviously, being an Alzheimer's researcher, but when I was invited to do this presentation, I was like, let me just read a little bit more about him to see what kind of impact he really had. And I was really blown away. So, he was born in Liberia in 1872, and his paternal grandfather actually immigrated from the US to Liberia after buying his freedom. He was enslaved, so he bought his freedom and his wife's freedom, and they immigrated to Liberia. But it was actually Dr. Carter Fuller's maternal grandparents who were medical missionaries in Liberia. And it's thought that that's where he got his interest and influence into being interested in medical science. So he left Liberia at the age of 17 to go back to the US and attend Livingstone College in North Carolina. And he began after he graduated from Livingstone, which was a private, historically black university, he began his medical career as a student at Long Island College Hospital in Brooklyn. And he completed his medical degree, his medical education at Boston University with an MD in 1897. And he was only 25 years old at the time. Yeah, and think about that time too, to be that young and African American in a society, back then, it was amazing. So, he completed like a 2-year internship, at Westboro State Hospital in Brooklyn, and that's where he really started to hone his skills as a neuropathologist. And neuropathology is just the study of the brain, the spinal cord, and nerves through removing tissues, either at autopsy or biopsy. So he became an expert in doing that and was actually selected by Dr. Alzheimer to come to his lab in Germany and work with him. Also, this is Dr. Carter with his lab mates, and Dr. Alzheimer is far on the left with a little mustache. So, sorry, I went too fast. So Dr. Carter Fuller really was a trailblazer for dementia research, at a time when African Americans really could not do much in society except for, work without pay. So he was a pioneer in neuropathology and dementia research. He is known to be the first Black psychiatrist in the United States and one of the first Black physicians to hold a faculty position at a white American medical school. Most African Americans at that time had to work either at Howard or Meharry, but he was able to become faculty at Boston University, and he developed a leadership training program in neuropsychiatry for Black physicians at Boston. And so I told you also that he was one of just 5 people, he was known as a research assistant back then, who was selected by Dr. Alzheimer to come to Germany and work in his lab. And so the impact that he's had on the field is immense and, and so unknown and understated, unfortunately. And, he actually, I didn't know this, but he learned German, and he was the one that translated a lot of Dr. Alzheimer's notes and papers into English so that, all of us in the US could understand what was going on. And including this, this is a note from Dr. Alzheimer. The woman on the bottom was his patient. Her name was August D., and she was only 56 years old in that picture. She, had what we now know as Alzheimer, but this is a note that he took. Dr. Alzheimer was her doctor. He was a psychiatrist in Germany, and he wrote about her, saying, from time to time, she was completely delirious, seeming to have auditory hallucinations. When the doctor showed her some objects, she first gave the right name, but immediately forgot everything. In a writing test, she repeated syllables, omitted others. In her conversation, she used confused phrases. She did not remember the use of particular objects. All of us probably have known someone with this disease and maybe have seen these kinds of things. This is an advanced case, but at that time, they thought this was a rare disease of middle age. But we now know that, that is not the case. And Dr. Carter Fuller was actually, one of the people who helped to discover the hallmark features of this disease, which we now know are called plaques and tangles, or amyloid and tau. Right, so this is a cartoon drawing of what the brain cells look like under the microscope. And on the left, you can see what a normal set of neurons should look like. But if you have Alzheimer's, it looks more like what's on the right, where you have these amyloid plaques that build up outside the nerve cells and keep the nerve cells from communicating with each other. And you have these neurofibrillary tangles that build up inside the nerve cell and just wreak havoc, so the cell can't do what it's supposed to do. So we now know that, Alzheimer's, these are the hallmark features of the disease, but we know there's other things happening in your brain as well. But at that time, in 1906, this was really groundbreaking to discover this. And so this is what, a real brain slice would look like under the microscope. This would be normal. But if you have Alzheimer's, you have, these plaques and tangles. And we know that, older people are accumulating these plaques and tangles starting really early in life. But at some point, you get enough in your brain that it causes the clinical symptoms of Alzheimer's. But again, at this time, we thought, oh, this is just, a part of this middle age syndrome. And we also thought that, okay, maybe this is just a normal part of aging. People are supposed to get this as they get older. But we know that Alzheimer's is not a normal part of aging. And the impact of Alzheimer's disease is growing almost exponentially now. 1 out of 8 Americans over the age of 65 have Alzheimer's. That's probably an underestimation, though, because most people never make it to medical care because they think, oh, it's just a normal part of aging. Grandma's supposed to lose her memory. That's normal. So a lot of people never go to the doctor, right? So that's probably not even, close to what it is really. And, it's thought that every 68 seconds, someone in America develops Alzheimer's. I always wonder how they figure that out, but that's what they think. And it's a really costly disease. It's estimated that over $200 billion is being spent on Alzheimer's every year. And of course, that's going to bankrupt us unless we find a way to either prevent it or find a cure, right? And there's currently no proven medication to prevent Alzheimer's disease. There are medications in the pipeline to treat it once you have the disease, but we don't have anything yet to prevent it. And that's where I work in the space to try to understand how we can prevent Alzheimer's. So if you look at the current, like who's affected by this disease now currently, I'm showing you on the left-hand side is the numbers of people over 65 who have dementia. So the Alzheimer's Association estimates that about almost 7 million people have the disease now, and it's really age-related. So about almost 2 million people over the age of 65 have it. That's the little yellow slice. The purple slice and the blue slices are bigger because it's age-related. So as you get older, your risk increases. So people over the age of 75 and 85 have a greater risk of the disease. So as more people affected with the disease. It's also really patterned by race and ethnicity. So on the other side here, you can see that African Americans and Hispanics are much more likely to have Alzheimer's than non-Hispanic white Americans. So 14% African Americans, 12% Hispanics, and only 10% non-Hispanic whites. If you look at data that's coming out of some of our large studies, this is an example of what the disparity looks like. So these are data that come from a large managed care system in Northern California, Kaiser, and they looked at medical records of over 270,000 people. And they found that African Americans had a higher incidence, higher risk of developing this disease at 26% compared to all the other races and ethnicities. You can see American Indian and Alaska Natives were close behind them. But the other groups were, intermediate, and Asian Americans actually had a much lower rate than anybody else. So, it's amazing that we have this disparity, right, that this disease is affecting some groups more than others, and we don't really know why that is. And if you look in the news, you see all kinds of breakthroughs happening. We even, every time you open a newspaper or turn the TV on, you'll see something about some breakthrough, some blood test, some new medication, right? You even have one of your stars here, Dr. Carlson, who was on TV for one of her studies, right? A lot of great research is coming out of Wisconsin, and science is moving so quickly. We are racing to find a cure, right? But for whom? Who are we racing to find a cure for? We started with Dr. Solomon Carter Fuller in 1897 or 1906, right, when he first discovered. What if he knew that more than 100 years later, African Americans are severely underrepresented in Alzheimer's and cognitive aging research? the man who started it all. What do you think he would think if he knew this is a disease that's impacting African Americans more than anybody else, but they are not being represented in research? A recent study that was done looked at the bulk of knowledge that's coming from science. They looked at about 8 of the largest studies, and they looked at the demographic breakdown, like who's in these studies. And they found that close to 80% of participants were white older adults. African Americans or black adults made up only 11% of these studies. And you can see the numbers for the other groups, even lower. And this is a disease that's disproportionately affecting black people, but they're not in the research. And if you look at neuroimaging studies, only 7.3% are black adults. And if you look at clinical trials where we are testing new medications for the disease, less than 5% are included in the research. This can't go on, right? This has to change. And in fact, people are starting to ask the question, why is Alzheimer's research so white? Alzheimer's disease disproportionately affects people of color. So why is the research so white? Do you know? I don't know. Well, some people think that, well, it's probably because of trust. It's a lack of trust. You know, black people don't trust. Well, the Alzheimer's Association, they did a focus group, a couple focus groups where they did look at some of these questions, and they found that black Americans were much more likely to believe that medical research is biased against people of color, right? So 62% of black Americans thought that. You can see the breakdown for the other groups. Their bar is much higher than anybody else. They also were less likely, if you look on this side of the slide, less likely to trust an Alzheimer's cure would be shared equally, regardless of race, color, or ethnicity. So there is some truth in the fact that there might be less trust among African Americans, not without a reason though. We all know that there's been terrible abuses in the past, right, with African Americans in research. But I don't think this is the entire reason that we are lacking in representation. I think it also has to do with how we are recruiting our participants. You know, I think that's at least part to blame. A lot of studies use these passive recruitment strategies that are not centered in communities of color. And most Alzheimer's disease studies recruit from well-resourced clinics and academic medical centers. Also, the inclusion-exclusion criteria to get into a study often favors white participants because you have to have few chronic conditions. You can't have diabetes. You can't have high blood pressure. You know, or you have to have access to transportation. So it really knocks people out before they even have a chance to participate. So I think that that's part of the reason that or maybe a major reason that we are really lacking in representation. So I want to talk to you about a program that I built at Rush to really try to change the narrative around aging for African Americans, and it focuses on prevention. So my program, centers diversity in cognitive aging research, and we have to first ask the question, how do we prevent Alzheimer's disease, and how do we study cognitive aging in African Americans? Well, you need to have large numbers of people who don't have dementia, because once you have the disease, it's really hard to figure out what caused it, right? So you have to get people before they actually have the disease. And you have to have people who are recruited from the community, not from clinics, because we know that many African Americans don't have a great relationship with the medical care system for the reasons, that we've talked about. And so if you only rely on the healthcare system or memory clinics, you're gonna get just a very select sample. So you have to go to where people are. And you also have to have people who will agree to be tested on an annual basis because Alzheimer's develops slowly over time. And you have to be able to assess a wide variety of risk factors. You also want people to be able to donate blood. And in my studies, we ask people to donate their brain at the time of death. Because you have to be able to look under the microscope to really see some of the pathologies. Now, some things we can see while you're living, with the image, an MRI scan or a PET scan. But there's still some pathologies that you only can look at under the microscope. So we do try to get donation of the brain. So, my studies are really built upon this concept of looking at people longitudinally over time, so studying them year after year after year so that we can identify what the risk factors might be that are causing this disease, and then determine what targets we might be able to pinpoint so that we can build healthy brains for older adults. And it really has to be built upon this model of inclusion, where there's a sense of belonging, of feeling respected and valued for who you are, feeling a level of support and commitment from others. That's what's been missing from research for Black people, quite frankly. Feeling like you don't belong, like this is for someone else. So we're trying to change that, by the research we're doing now. So I started the Minority Aging Research Study. It's called MARS. I see you have a MARS here in Wisconsin, but this was the original MARS, just so you know. It was established in 2004. Sorry. And we enroll older adults over the age of about 60, again, without dementia. And currently we have over 850 African Americans in the study. It's a rolling admission. So, we're constantly recruiting and enrolling, just keep going as long as I have money. And people are recruited from like churches, senior buildings, clubs, organizations, sororities, fraternities, any, kind of an organization that caters to older African Americans. That's where we go. And we take our research to people. So we do all of our testing in their home, in the community, including, cognitive testing. We look, examine the risk factors. We do blood draws in the home. And our follow-up rate's been really good. It's been over 90%. People, they like it. They stay in the study, which is amazing. It sounds like a lot of you here are also the same with your studies in Wisconsin. You are committed, right? Over time, only about 10% have developed Alzheimer's dementia since we started the study. And we started asking for brain autopsies in about 2011. And it's an optional component, so you don't have to do it, but we always educate about why it's important, and our numbers are slowly growing for that part. So, our theme is sort of community-centered engagement, where we really talk to people about, brain aging, healthy aging, memory loss. And, we go to where they are. So this picture here is me many years ago. I found out about a tennis group that had been getting together on the south side of Chicago, playing tennis for many years. And, I went out there with some Chinese food, and I gave a presentation on healthy aging. And, most of them signed up right there on the spot, right? Because I wasn't waiting for them to come to me. I went to them to try to tell them about the study. And our main tenet, though, is that we give first and meet community needs before we ask for anything. So I think that has been sort of the groundbreaking part that Megan talked about. Is because, we're out there first, giving. We don't want to ask you for something before I'm able to give you something, right? So I spent several years in the community giving, until I was able to finally get the nerve and the courage to write up my first grant and then go back out there and say, hey, do you mind helping me out? And I got 200 people enrolled in the first year, because they knew me, they saw me, they knew that I cared about the research and about, my community. And so they were willing to help. And we put on these culturally celebratory retention events. We make sure we acknowledge and thank them for everything that they do. So that's really an important part too, of giving back. So we not only give first, we also give back, making sure we tell them what we're finding, what it means, how they're contributing to science, and getting their opinion and buy-in on different things. They give me all kinds of ideas about what I should ask about in the study, And so I have to always thank them for what they do, because without them, I would not be here. So the study is, this is the design of the study. You don't have to really focus on the picture as much, just to know that we enroll people in the beginning who don't have dementia. We ask about all these risk factors, and then we follow them year after year after year. Some people will develop the disease, some will remain healthy, but we can see how the risk factors lead to either development of disease or keeping your brain healthy. What are some resilient factors we might see? And then some people die and come to autopsy. We can look at their brains under the microscope and see how the risk factors are related to the pathology. So this is what the participants look like. It's mostly women because women live longer and they tend to be more likely to volunteer for research. You know, I'm trying to get more men, so if you have ideas, let me know. But men are hard to get into research for some reason. So they're about 84 years old now. They're fairly educated for older African Americans, about 14 years, which is consistent with a healthy, volunteer, cohort. Over 200 have died, and we have over 400 who've gotten neuroimaging every year. And about half of those who are still alive have agreed to give their brain when they die. So that's, really, really amazing. So I want to just go through, sort of quickly, what are some of the select findings that we have learned about African Americans and cognitive aging? So we know that, we've known for a long time, that health is mostly determined by what happens outside the walls of a hospital, right? Your genes only account for 10% of your health. Clinical care only accounts for 10% of your health. All the rest is what you do and your social conditions that you're embedded in, right? That's all the rest of your health. And it's the same for brain health, right? So your brain health is largely determined by the social conditions upon which you live or the health behaviors that you engage in. And so, we know that race is a social political construct. It's nothing about biology when we're talking about race. We are all the same biologically, right? We all have the same parts, same brain, but we live in different worlds when it comes to the United States, unfortunately. And so our experiences are shaped by external forces and historic events. And so in my study, I've tried to leverage that to understand how it's impacting brain aging. So one of the things that we know happened to this cohort of older African Americans is something called the Great Migration, in which more than 6 million Black Americans left the Jim Crow South to escape the oppression there, and they migrated to the north and west parts of the country, right? And this has been well documented. You probably may have read the book, The Warmth of Other Suns. It tells you all about these personal experiences. Well, all of our participants live in Chicago now, but we ask them, where were you born and where were you living at age 12, right? And then we test their memory and thinking skills. And we found that those people who were born in the South or living in the South at age 12 perform more poorly on our memory and thinking tests than those born in the North or living in the North at age 12. But there's so many different things that were different between the North and the South, right? It could have been anything. But we know one thing that was very different was education, right? Because right before 1954, Blacks went to school in segregated school systems because that was the legal thing. But in 1954, with the Brown versus Board of Education decision, it outlawed segregation, said it wasn't legal. Separate schools was not equal or constitutional, and you had to have students working together, going to school together. Well, we asked people about their experiences of attending segregated schools, and we didn't find that segregation itself was associated with poor memory performance, but we did find that people who were born in the South and attended a legally desegregated school, I'm outlining it in the red box here, they had lower performance than any other groups. Even their counterparts who were going to school in the South in segregated schools. We were surprised. We thought, oh, surely the segregated schools are going to be worse for you, right? Because it's fewer resources. The teachers are different. But we found the opposite. And you can look at the picture here, this little girl having to be escorted to school, with armed guards because there were people standing outside throwing things, spitting, cursing, calling her names. This was a common occurrence for these children, right? And so it probably was a stressor that impacted their lives in ways we don't even know. But when we test their memory 50, 60 years later, we see that they're performing more poorly. And I asked my participants, what do you think about this? And they said, that's one possibility that it was a stressor, but on the flip side, the kids who were in the segregated schools, they were there with teachers who cared about them, teachers who nurtured and made sure that they had what they needed despite the low resources. So you're seeing it both ways, right? You're seeing that it was a stressor to be in an environment where you're not wanted, but at the same time, you're in another environment where you are loved and nurtured and they're gonna give you everything you need to succeed, right? So it's a complicated picture, but without asking the question, we wouldn't know what was going on here. Now we've looked at other experiences, like everyday discrimination. We use a simple scale where we ask people like how often, are you treated with less courtesy than other people or less respect or, people think you're not smart. These are microaggressions, but they happen all the time to Black people. And we needed to know, how's this impacting cognitive aging? We were one of the first groups to look at this, and we found that people who reported more experiences of discrimination did worse on our memory and thinking tests, right? So being treated unfairly is definitely doing something to your brain. It's hurting your brain in some way. We also found that those people who reported more discrimination had more C-reactive protein in their blood, which is a marker of inflammation. So it suggests that these people who are getting this unfair treatment is happening, is doing something to their bodies, and that's then affecting their brain. We've seen it also when we look at their brain in neuroimaging, that people who report more experiences, we see a different pattern in their brain. And it's the same pattern that's involved in trust perception. So it's showing us that there's some kind of neurobiological footprint of being treated unfairly that we can measure in our studies. We've just recently published a paper, just came out a couple weeks ago, that showed that people who reported more discrimination also have an increased odds of being hospitalized. So again, this unfair treatment is affecting your body, landing you in the hospital. It's not good for us, right? We also can understand how coping with this type of stress is affecting your brain. So John Henry was a fictive character. You may have heard of him. He was a steel worker, and when the steel machine was built, he was going to lose his job. And so he tried to prove that he could outdo the steel machine, and he wasn't able to do it, obviously, it was a machine. But the effort that it took for him to try to beat this machine, we measured that as effortful coping. It's called John Henryism. And it's a strategy for coping with prolonged exposure to stress. And we measured our participants to see where they fell on this John Henryism scale. And we found that those people who had more of this high effortful coping, they performed worse on our memory tests. And it was equal to having fewer years of education. That was the impact. And so we have now started to expand our questions to look at not only the individual and what's happening to the individual, but their surroundings and where they live and how that could be impacting their brain health. And so we have our participants, we know where they live because we go to their homes to do the testing. We geocode all of their locations. So the purple dots on the map of Chicago show you where all the participants are. They're pretty spread out, but most are sort of segregated on the south side of Chicago, because Chicago is one of the most segregated cities, in the U.S. So a lot of our participants live on the south side, and we were able to measure the conditions of neighborhoods using this index called the Social Vulnerability Index. It was created by the CDC for disaster preparedness. But in this index, we can find out about the socioeconomic status of the neighborhood, about household characteristics, the racial and ethnic breakdown of the neighborhood, the types of housing in the neighborhood, and whether or not there's access to transportation, and you get a score based on that. And we found that people who lived in these higher neighborhood level social vulnerability areas had worse memory performance, poor brain function than those who lived in better neighborhoods. So this is impacting African Americans because they tend to be segregated in these types of neighborhoods. So, showing again that the social environment is important in where we're coming up. And I just want to make the point that these questions aren't usually, interrogated, or they weren't. They're starting to be now, but they weren't really interrogated because we thought that either, there was some biology with this disease, or it was just, the usual types of questions we were asking. But we now know you have to talk about the lived experience of older Black adults, because we live in two different worlds, unfortunately. I wish it was different, but the reality, look, turn the TV on. We live in different worlds, and we have to be able to see how that impacts us. But I don't want to end on a gloomy note. This is a celebration. So I do, in the last minutes, I want to talk about what are some things we have learned that can prevent you from having or getting this disease, or help you protect your brain health, a little bit longer, right? We don't have anything that's a surefire cure yet, but we found some things that seem to be protective. So, and these are things that everybody can do, regardless of race, ethnicity, class, whatever, right? So we ask our participants about amount of time that they spend doing common cognitive activities, like reading books, magazines, newspapers, playing games. And we found, playing cards, bid whisk, right? We found that people who do more of those types of activities, they have a lower risk of developing Alzheimer's and a slower rate of cognitive decline over time. So the message here is keep your brain active. I don't care what it is. Do something to keep your brain active. Read a book, read a magazine. I don't know about watching TV. That might not be a good one, but maybe, in another language, you can try to understand another language. But just do something to keep your brain active. So that's one key message. We also found that people who remain socially active are protected from this disease. So we asked people about, how much time do you spend visiting relatives and friends, going to museums, social outings, attending church, participating in clubs. We found the people who reported more social engagement were protected from this disease and had a slower rate of decline. So that's something we all can do. You're here today. This is a social activity. You're also learning something, hopefully. So it's cognitive, but you're sitting with people you like and know and seeing old friends. That is social engagement. So keep it up, right? The next thing we looked at was physical activity. We found that people who were more physically active had protection. Probably because when you're physically active, you're reducing the risk of, cardiovascular disease, diabetes, obesity, hypertension, all those things we know are related to poor brain health. So if you just move something every day, you don't have to join a gym, just walk around the block, do something every day to get those muscles moving. That's going to help your brain as well. And then the last, I just have three more. We have been looking at diet, and we've, have found a number of studies that eating a healthy diet is good for your brain. I hope today you had something healthy. I had a different thing on my plate, but it looked like you had some good stuff. So hopefully, you have lots of greens and vegetables, because that's going to protect your brain. And we've looked at that, in our observational studies and also in our neuropathology studies. We see less plaques and tangles in people who are eating healthy foods. So definitely good for you. And we're starting to look at sleep now, and we know that sleep is important for many, many different health outcomes, and it seems to be also important for the brain. So get a good night's sleep. And finally, manage your stress. How much do you feel your life is unpredictable, overloading, and overwhelming? We found in our participants that those people who reported high stress levels had a faster rate of cognitive decline. So whatever you can do, cut out those people who are getting on your nerves, or that job that's getting on you, whatever it is, cut it, because we need you here. We need you to be healthy and happy. So slow down, take it easy, go outside, enjoy life. So I just want to wrap up. Alzheimer's research began with the involvement of an African American, Dr. Solomon Carter Fuller. More than 1 century later, African Americans are not represented in this kind of research, despite being disproportionately burdened by the disease. That is a travesty. If we don't change this, an important segment of our population will not benefit from medical advances in brain health because science is moving forward with or without us. We have to be a part of the equation. What do we learn by being more inclusive in our research? We learn that social determinants of health are important for cognition and brain health in older African Americans. And we learn that understanding the lived experience of older African Americans will advance our understanding of brain health and show how everyone can age better. So thank you very much for your attention, and I am happy to take any questions. Thank you. I think there's a mic, yes.
I just have one question. I saw where it showed eating healthy, but I didn't see anything in there about gardening.
Gardening. You know, that's really interesting because we do ask about gardening in our physical activity questionnaire. I don't know how many people garden, but you know, it does seem to be helpful. You garden? Okay. So keep that up. You know, it's a physical activity. And I guess if you eat what you garden and it's good, that's going to help the brain too. So yeah, gardening's good.
If you have a question, please raise your hand.
Good afternoon. I brought this up last year, and for the past 5 years, my father passed away about 14 years ago, had donated his brain for science for Alzheimer's program. His brain did not get to the right people. So there's one brain, African American male, could have been used. I want to know, or I want to suggest that we need to talk to the hospitals. We put DNR notices on the chart in the bed. On our driver's license, we put organ donor. How can we make this accessible to the people, the staff there? Say, wait a minute, hold on, don't bury him, don't cremate him. He's offering his brain. How can we do that? And I just like to suggest that we find a way to, talk to our parents and talk to people who know they have dementia or Alzheimer's, and have them either sign something or tell their medical staff. Thank you.
Yeah, thank you for that, and I'm sorry that happened to you because every person is precious, and so we can't have that happening. I think you're right. It takes education, constant education and communication. So, if you have a loved one who you know has decided to give the most precious gift they can give, which is their brain, we have to make sure that everyone knows. If they go to the hospital, talk to the staff and say, if my loved one passes, this is what should be done. And you would think that the hospital staff would know that, but they're busy and they don't keep up with every single detail, unfortunately. They can't. But it's up to us to be empowered to make sure they have the information that they need, because this is your loved one's dying wish. If they've been in research, they want to give their brain, we have to honor that. So I think it's up to us, the people who are still here and healthy, to make sure that message gets out. And in my own study, we're constantly giving the family members information, because they're the ones who have to call us, and so that's been a huge challenge for us, because a lot of times family members are not completely on board, but we just try to do everything we can to educate them about why it's important and why they should honor their loved one's legacy. So we should all do that, take a part in doing that.
Are there any other questions?
Right here.
Not exactly a question. I wanted to thank you so much for everything you've done and the reaching out to the community and establishing relationships and trust. And I mean, that's a beautiful thing and it makes total sense. My mom passed away from advanced dementia, I believe, this past year, and I wanted to very much donate her body to science for this specific cause for future research. And I was told that unless you're a participant in the program, then that wouldn't have been a possibility. So maybe just to piggyback on what she mentioned, I didn't quite catch the entire beginning of the conversation, but is that true? I mean, for myself, I'm going to go out and sign up for something.
Yeah.
Anyway, I'm not 55 yet, but I'm getting close. So if you want to, you know, contribute to the research, do you find that that's true, that a person has to be in the study in order to donate their brain?
Yes. First, I'm really sorry for your loss. It is true for many studies, because in order to understand what we see in the brain, we have to know something about their lives, about how they performed, or the memory before they died.
That makes sense.
So a lot of studies do require that you are enrolled in the project before you donate. There are other, ways you can donate your body, to science, though, that's not research. A lot of medical schools will take your body and your brain, for medical students, which is also important. But for research, yes, we need you to be a part of the research first.
I did make the question, sorry.
Okay. I don't know where the microphone went.
Oh, I can wait, I'm sorry.
Your program in Chicago, where you said you started taking participants at 60, is there a cap for participants, the age that you take people?
No, great question. No, we will take people as old as 100 if they still want to be in it. And I started with 65, but I had to lower it because when I go out to places, people are like, I really want to be in this. And I can't turn people away, right? We don't go much lower than that because you don't really start seeing a lot of changes. I mean, I think you all are seeing stuff in your RAP study, which is a groundbreaking study. But we found that if we try to get organ donation, people, they live a long time. And so it's really not feasible to get somebody in their 50s and then wait 50 more years for them to die. So, we get people, a little bit closer to death. I don't want to be morbid, but, 65 and older. So we, can try to understand their aging process. But we can take people as old as 95. We have some 100-year-olds in our study. It's amazing. And they're still healthy and, doing things. So they are great participants to learn how to be resilient, right? How did they go through all the things they went through and they made it to 100? That's how I want to be.
We are running a little short on time here, so we're going to take 2 more questions, and I have one here. So if there's anyone else has one, just raise your hand.
Thank you so much. I have received differing information. Originally, I thought that Alzheimer's couldn't be, in other words, you wouldn't know for sure if the person had it until post-mortem with an autopsy and examining the brain. I feel like I was getting that information, or that was my understanding before my mom passed away. And I don't know if that's true or not, but that I've also heard about the biomarkers or other tests. So could I go in and see if I'm knock on wood, if this is a disease I'm gonna get? Double down on the preventiveness of this?
Well, research has advanced. So it used to be the case that we had to look at your brain after you died to get a definitive diagnosis, right? But now with PET scans, and we now have biomarkers that we can measure in the blood, we can be a lot more confident whether or not you have the disease. And so, that's just an example of how quickly science is moving, right? And eventually, maybe we will have a blood test that will tell you. We're not there yet, but, a lot of information can still be gleaned while you're still alive. So I would encourage you, when you reach the age, I think RAP is taking people in their 50s, so you might, yeah, so 40. So you can join today. You don't have to wait. So yeah, if you're out there on the fence thinking about, is this research for me? I don't know. It's for you. If you're not a part of the problem, okay, good. Go. She wants to sign up. We need every single person in here to be in research.
Please stop at our ADRC AA-FAIM table. It's the first table on your way in. There is a sheet there, a recruitment flyer, and you are welcome to call me to get registered.
One more question?
Yes.
Okay.
Actually, my question has to do with amyloid plaque. And what I was hearing at the Boston CTAD, thanks to... Okay. Is that, the amyloid plaque levels in African Americans is oftentimes lower. And that might prevent us from being in clinical trials, because if they're really looking at the amyloid plaque as being, more prevalent
Mhm.
than if we don't have it, even if we have Alzheimer's or the beginning stages. So that's one of the questions I want you to address real quickly. But
Yeah.
I just also want to speak to the person who, I think Miss Pina, who, I mean, that's horrible that happened to her father. I am in the process of doing my estate plan again, and part of it is having that UW-Wisconsin Alzheimer's donor. It's at the front of the binder. It's
Okay.
on all my paperwork. Everybody is going to be made aware of what to do, because that's a barrier, because my family didn't want me to donate the brain because it was awful for them to think about that. However, when they understood, like the education, and they had well, who do we have to call? The funeral homes, Foster Funeral Home, Crest Funeral Home, and others now have a process, one call, and you can get that taken care of. And that's what we need to be educating people about.
Yep. Yes, thank you for that. That's very true. So for your question about the amyloid, you know, the studies have been mixed, right? And so we don't have a lot of information. The few studies that are out there suggest that amyloid could be lower, tau may be lower, but we really need more data to be sure. Most of these studies come from, you know, really select small studies, you know, where people, you know, are highly educated, they come from memory clinics, so we don't really know what's happening in the community. In my study where I get the brain at death, I'm not seeing any differences in amyloid and tau.
Okay.
You know, so it suggests that if you come from the community and you don't have dementia, you're having the same process as everybody else, right? But we still need more data to be definitive about that.
Thank you so much.
Thank you. So I just want to, I had one more slide. I can't believe I forgot. I have to acknowledge my participants, you know, who've been with me for 20 years. We're celebrating 20 years. We're going to have a huge party in Chicago. And the funders for my work and the staff at the Rush Alzheimer's Disease Center. And thank you all for being such a great audience today.
Oh, my goodness.
Thank you.